Trotter joins us now to discuss her dental practice and innovative treatment procedures that she provides. Welcome back to the show. You know, so much has changed in general dentistry and cosmetic dentistry. Everybody's concerned about making sure that their teeth are white. This is one of your areas of expertise. You brought along some things. We're interested to hear about them. Welcome.
Thank you, Karen. Thanks for having me. One of the first things that I want to talk about is the Zoom procedure for whitening patients' teeth.
All right. And this is the big white contraption that you brought in.
Yeah, correct. This is actually a light.
Okay.
Okay, so when a patient comes in to whiten their teeth in our office, we seat them in the chair and we apply a rubber dam type of material over their teeth, and for 15-minute sessions in which we apply a whitening solution. They sit under the lamp, they sit really still, we rinse the solution off, and when we apply the solution, it's one of the things that we can do to actually whiten, brighten, and lighten people's teeth.
Excellent. Okay. So I guess you put the chemical on first, and then the light kind of accelerates the process of it working.
Absolutely. It activates the whitening solution that is on the patient's teeth.
Excellent. Yeah. That's one way to do it. You also brought along veneers. I hear a lot of people that use veneers, and for a long time I didn't know what they even were, but they're actually they're like a tooth that goes on top of the tooth. You want to explain it?
Oh, sure. That's what a great question. I know that a lot of people have no idea what a veneer is, and lots of times you'll see a movie star or say a singer, all of a sudden their smile changes, and you're like, wow, how did that happen? Well, we in the profession know that a lot of that is accomplished with the use of veneers. And what a veneer is actually a 0.5 millimeter thin, almost like a fingernail, okay?
Wow, so it's very...
Very, very thin.
Very thin.
Okay. The teeth are minimally shaped, and then the veneers are cemented on top of the tooth
itself.
And as you can see, we've got a broken tooth. Here's a veneer that's been placed. These are kind of, you know, not an ideal model. Here's another broken tooth, but you can see how this would transform an individual smile in no time at all.
I've seen people that have actually had such bad teeth. I worked with somebody one time, and he was so self-conscious about it he couldn't even smile, and he was afraid to, and I guess he just let his teeth go. But you know, it just had happened naturally, I guess, over time from eating bad things and drinking bad things. He ended up with veneers. He smiles all the time, and you can tell his whole confidence in his whole life has come back.
Absolutely. We can change people's lives by placing veneers on an individual's teeth.
Right, because you can exude yourself without trying to trying to hide something. Now, I also know that you have a fantastic practice in Riverside.
Absolutely.
That is in such innovative ways besides general dentistry. Let's take a look at that right now.
Hello, I'm Dr. Linda Trotter. I would like to invite you to visit our modern, relaxing Riverside dental office, where dentistry may be our profession, but patients are our passion. For a limited time only, new patients will receive a free take-home whitening kit with their exam, x-rays, and cleaning.
From general dentistry to specialty procedures, including dental implants, veneers, and Botox, Linda Trotter and her staff can handle all your dental needs. Visit them in Riverside at 2522 Oak Street or online at lindatrotterdmd.com.
And that's Linda Trotter right here, live in person. And Botox and other types of treatment, as we age, which we don't want to admit, but our skin starts to sag, the elasticity goes out of it, we lose the fullness between 30s, 40s, 50s, and on. One of the things that you can do is help put the fullness back into the face, back into the mouth. And that's the third product here, correct?
Absolutely. Yes, once we've worked so hard to reestablish an individual's smiles, either with veneers, crowns, or bondings, one of the things that we know is that the lips actually frame the smile. And if a individual's lips are deflated, flat, the perioral region is not as full and voluminous as it used to be, one of the things that we can do is use facial fillers and Botox to upturn the lips, fill in the nasolabial folds, and refresh and rejuvenate an individual's smile.
Okay, and that is so important. Everybody wants fat lips, so we want to look like Angelina Jolie because it looks good that way. All right, so if anybody's watching now, I want you to call the number on the screen, and if you mention Look Local.
Absolutely, Look Local. For the month of February, we're offering $100 off our Zoom whitening if you call the office and mention Look Local.
Love it. Okay, we'll be there because every little thing we do helps the overall product of how we are. Thank you so much, Dr. Linda Trotter, for coming in.
Thank you, Karen.
Great
Thanks
to
for
have
having
you.
me.
Love it. Okay, thank you. Coming up next, 904thin.com, helping you lose weight and get healthy at the same time. Plus, registration is now open to all Florida and Georgia residents who want to attend the national meeting of the Hearing Loss Association of America. This year, it will be held in Salt Lake City, Utah. It will be filled with seminars and workshops with all the latest information regarding hearing loss and what can be done about it. New technology combining hearing aids with cochlear implants via Bluetooth technology and much more. For more information, go to hearingloss.org/convention for more information.